Hmm.
There you go. All right, well, it is 1:30. Thank you all for joining us. I'm your bishop, Jennifer Redall, and I think I've met most of you. It's nice to see such an enthusiastic reception for this. I'm here with Clarissa Ortiz, who is our, Clarissa, what exactly is your title?
HR and payroll coordinator.
HR and payroll. I mean, she does all the HR things, all the payroll things, and she's amazing. And we're going to start with a prayer and then get going and share some information to you that is hopefully helpful in leading your churches and in making decisions for the future. So the Lord be with you.
And also with you.
Let us pray. Creator, we give you thanks for all you are and all you bring to us for our visit within your creation. In Jesus, you place the gospel in the center of the sacred circle, through which all creation is related. You show us the way to live a generous and compassionate life. Give us your strength to live together with respect and commitment as we grow in your spirit. For you are God, now and forever. Amen.
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 So this presentation is a mix of two sources. One source is the parochial report data that the Episcopal Church produces every year. And the other part of the report is from Church Pension Group, which gives a diocesan report to us once every couple years. But it gives us a little information of sort of like where we are as a diocese and gives us some direction, I think, into some things that we can do that are helpful for our diocese, just generally, both in your congregations and for the diocese as a whole. So some of this information will probably be more interesting to you if you are, say, a parish administrator. Some of it will be more interesting to you if you are a clergy person. Some of it will be more interesting to you if you're like a senior warden or something. But hopefully all of it helps give a little bit of the whole. So Clarissa, can you go ahead to the next slide? So this is just a little bit of comparison for our regional average Sunday attendance and income in congregations, because I often get congregations asking, like, they think that whatever their church is smaller than normal. And so this is just, again, from the parochial report data. So our diocese, we have 57, and they say parishes, that means 57 churches. So not church plants, not college chaplaincies. The average operating revenue for our congregations is $318,000 a year. Our average Sunday attendance is 91. The average seating capacity of our buildings is 320. 47% of our congregations run a deficit. And they compare those statistics to our province. We are in Province 8, which is basically the west coast of the United States, sort of, and then from Arizona up to Utah and up to Idaho, and then all the way west to actually Taiwan, which is part of our diocese, and includes Hawaii. And so you'll see from this slide, just so it's our province, then the Episcopal Church as a whole, and then what the CPG claims as similar type diocese. And so similar type diocese is a description that will come up a couple times in this presentation, and it's a definition that I have not yet managed to get an actual data on what they mean. But it's some combination of about our size in terms of the number of congregations we have, and about our size in terms of the budget we have, and about our size in terms of the number of people we have here. And just so you know, some of the dioceses that they identify as similar to us are Georgia, not Atlanta, but Georgia, Central New York, Mississippi, San Diego, Oregon. There's a couple others, but at least gives you an idea of sort of like, we're not New York and we're not Navajo land. And then the decile is the congregations that are in our, or the dioceses that are in our specific decile, or 10% of in terms of size. So you'll see our congregations tend to be bigger on average than most dioceses in the Episcopal Church. I like to just share that with you because sometimes I think people feel in Arizona like, oh, we have a lot of small churches. We do have a lot of small churches, but we don't have as many small churches as most dioceses in the Episcopal Church. And when it comes to our average operating revenue, again, we have about slightly higher than the average operating income for Episcopal churches across the Episcopal Church. So that's by way of sort of giving you a little bit of confidence about sort of where we are as a diocese. Next slide. And this is within our province. And this is one that I think is really important for anyone who's leading a congregation in Arizona to see. So if you look at, and I cherry picked some of the most similar type dioceses in our province. So it has the diocese listed, the average Sunday attendance of that diocese. You will notice we are the third largest diocese in Province 8, according to our average Sunday attendance. And then the plate and pledge for the whole diocese. And then they do some division between that to figure out, like, what is the plate and pledge per attendee for each diocese? And if you look at the plate and pledged per attendee of our diocese compared to the other dioceses in Province 8, you'll notice we're kind of right in the middle-ish, right? We're not high, but we're not low. We're not California. We're not Olympia, but we're sort of right in the sweet spot there. When it comes to total income for all of the congregations of the diocese, and they do the division of income per attendee, you'll notice something really different. Our diocese has an average of $1,300 per attendee higher on average. Other dioceses have much bigger, get much more income from sources other than plate and pledge. Which is to say, if you are leading a congregation in the Diocese of Arizona and your only source of income is plate and pledge, we want to work with you to find other sources of income, whether that's through renting your building, whether that's through planned giving and creating an endowment that can generate income. But our diocese falls behind when it comes to having other income. Because if we were able to raise our total income in such a way that we had the same type of leap between plate and pledge per attendee and income per attendee that the other dioceses in Province 8 have, that would be a lot more revenue to guide and lead your church. Some of our churches are doing really good at this right now. Other churches are not. So if this is something that you can bring back to your bishop's committee or your vestry, that's one of the reasons we're having this conversation today. And we'll take questions at the end and can have more conversations about it. Clarissa? Next is just want to look at who's leading our churches. So this is ordination totals by year. So deacons are orange, priests are green. And so you'll see that we have very uneven ordinations per year of priests and somewhat more stable ordinations of deacons. But this is one I want to highlight to you as leaders of your congregation, because the Episcopal Church has a priest shortage. We have more congregations that need priests than we have priests. So if you are in a congregation and you see someone who has the capacity to potentially be called to the priesthood, it is important from our perspective for you to be reaching out to that person and saying, hey, when I see you and I encounter someone who seems like, you seem to have a good relationship with Jesus. You seem to be someone, I wonder if you're called to lead a congregation. Can we have a conversation about this? Have you spoken to our priest or our deacon or someone about that? We also are in need of deacons in our congregations. And we are shifting our model for deploying deacons across the diocese, so that it had been that for the most part, if you were raised up in a congregation, you would serve that congregation. We are shifting it for people entering the process, that unless geography means you have to serve in the congregation you're serving in, like if you're raised up as a deacon in St. Luke's Prescott, you're going to serve at St. Luke's Prescott because there's not another church around. But if you are in Metro Phoenix or Metro Tucson, we are going to call you once you are ordained to serve in a different congregation and get our deacons moving around more. Clarissa, next. Next is ordination totals per year, and this is ordination of priests. It's not ordinations, all ordinations. So you will notice in our diocese that the average age at ordinations is in the 40s. That's okay, it's kind of average. But if you think about it, if you're calling someone to priesthood and the average age is mid-40s, if you're ordained in your mid-40s, you've got 20 years to serve the church, 25 years, which is pretty good. But that's the average, and we are ordaining some people in their 20s and 30s, which means we're ordaining some people older. We would love to have the average age go down some, because we need to be calling people into priesthood who have 25 years or 30 years of ordained ministry ahead of them to help our church grow and thrive, so that you have senior people with senior experience in the church. Happy to keep on ordaining people who are second career people. But when you look at this, you realize like, oh, okay, this shortens the timeline for people to be able to serve. Next slide. Compensation is an issue that comes up whenever a church is in transition. So this is the median compensation for priests within the diocese. You'll see deacons are listed there because deacons' median compensation is $300 a year, because deacons generally serve on a voluntary basis. But you'll see, and I think this is from I think these numbers are from 2024. So the median compensation for what CPG terms as senior rector, it means a rector at a congregation that has another clergy person. That can mean, per their definitions, a priest serving at a congregation with a deacon. Doesn't have to be like a full-time associate priest. But you'll see senior rector positions, median compensation $105,000. Specialty ministers means like a school chaplain, dio staff, something like that. Their median compensation is $71,000 a year. Solo rector means you're the rector of a church and there are no other clergy present. Median compensation is $70,000. And the median compensation for associate clergy in our diocese that year was $61,800, which was what diocesan minimum was. So you can see there's a spread there. And these are medians. And a reminder for anyone who hasn't taken middle school math recently, median is not the average. Median is the middle point. Like if it went from 0 to 100 and everything was, it was 1, 2, 3, 4, 5, 6, all the way up through 98, 99, 100, median would be 50. And so this gives us a good sense, better than an average, because if you have an average, a high one or a low one can kind of skew the whole total. Next. Oh, wait, go back. There we go. And this is the one that I really wanted to show you. Median compensation by gender. And this includes our diocese, similar type dioceses, and our decile of diocese. So there's good news and there's bad news in this slide, obviously. The good news is the gap between male and female clergy and median compensation has been made even. The bad news is our median compensation in the Diocese of Arizona is lower than similar type dioceses and similar than our decile in the Episcopal Church. So what that means is you can be equally badly paid in the Diocese of Arizona, regardless of your gender. So it's good news, bad news. We've actually worked at this. When I started as your bishop, the gap in median compensation by gender was $10,000 a year. And so we have intentionally been conscious of who we were calling and how we were calling and how we were advocating people and how we were bringing up diocesan minimum compensation, so that it did not happen by accident that we have closed that gap. But it is still a gap. And so for any churches that are in a search process, this is a good slide to be aware of, because when you think of how do we attract clergy into or how do we attract priests into the diocese, it is enough of a free market system that if I am a priest and I have a choice of serving at a congregation for $72,000 a year, or serving at a congregation in another diocese for $80,000 a year, that's the type of difference that may make a difference in whether we attract candidates here. Next slide, and then I'm going to turn it over to Clarissa. Are you doing this one, or am I doing this one?
You can totally take care of this one, Bishop.
Okay, so this is information from I gotta get the code down here. This is information from Church Insurance, who insures, I think, all but one of our churches. And we love Church Insurance. They are good and consistent, and they pay out when they need to pay out. But they have done they have basically taken all of our congregations and looked at and divided us into different risk levels. So a green risk level can cover their deductible and 1 month of operating expenses using year-end cash. Right. So if you think about it, that means you're a financially stable congregation, right? You're not in a deficit situation. You've got extra cash on hand. Yellow congregations can cover the deductible, 1 month of operating expenses using year-end cash, and up to 10% of your reserves and investments. Orange congregations can cover their deductible, 1 month of operating expenses using year-end cash, and 10 to 50% of your reserve funds. Purple congregations can cover their deductible, 1 month of operating expenses using year-end cash, and 50 to 100% of your reserve funds. Red congregations cannot cover their deductible. And so if you look at this spread, you'll see that we are about where our province and the Episcopal Church is in terms of the percentage of our congregations that are green, but we have much higher purple and red congregations. So our hope is that by working with congregations who are in the purple and red areas, we'll be able to bump you up by helping you get to a point where your budget doesn't have a deficit, and where you have reserve funds that allow you to cover something that might happen that goes wrong. And after the presentation, if people have questions, we do have a list of which churches fit which color. And I imagine a bunch of you are sitting there wondering, I wonder where my church fits. So we can answer those questions at the end of the presentation. And Clarissa, I turn it over to you.
Thank you, Bishop. Okay, so we're going to start by talking about what coverages that we offer here in Arizona. Last year, we did adopt Cigna. Prior to that, we've only had Anthem. We offer 3 different tiers: silver, gold, and platinum tiers. They include PPO 70, PPO 80, PPO 90, and then the H2 HSA plans 20 and 15. Our platinum tier does not offer an HSA or FSA option. We also give employee assistance programs, formerly known as EAP, and MSP plans that are available for PPO plans, and that's Medicare Secondary Payer Plans. That's what the MSP stands for. And then we offer basic and premium dental. That's what we offer here in Arizona. We're going to go through a series of slides that were given to us by CPG, kind of detailing out all of our rough estimates across our diocese that affect our overall health costs. The first one is going to go into care in our diocese. The care that we receive here in our diocese is mostly received by employees who seek office visits. The other category that you see in in blue, the 34%, means that they're typically receiving home health, telehealth medicine, or miscellaneous professional services. This is probably more likely since we cater to a population with higher ancillary needs. The below categories in the graph will show that our physical therapy, occupational therapy, and speech therapy is down. However, it's still being over 700% over the benchmark. That's kind of a red flag, but it typically points to the overutilization, high frequency visits, and high cost providers. Our medical and surgical categories are both up 13%. This includes diagnostic testing, radiology, lab services, and non-surgical procedures. The double-digit increase is suggesting that we have increased testing and more chronic disease management needs. All of these are going to attribute to higher medical premiums. This is our preventative care. I've broken it up into 2 slides. So this first slide that we're going to look at is females. Because we don't employ anybody less than 15, we're going to look at the 3 on the end. That's going to be that the preventative care has decreased in females ages 40 to 65. And then in males, the preventative care visits decreased from ages 12 through 17, and we had no movement for the ages 18 through 39. But the good news is that we did increase in our visits for ages 40 and over.
Clarissa, I'm just going to interject. Why is it that we care about how many people who have preventative care visits?
So the reason that we care about preventative care visits is because we want people to seek preventative care so that they're less likely to have emergency care, which is always higher. So the more preventative care that we receive, and the more that our employees receive, our priests receive, hopefully that brings down the costs of our premiums.
And this is a metric that church insurance looks at, or the Episcopal Church Medical Trust looks at, is what percentage of people have preventative care visits in setting our premiums. So if we want lower premiums, we need to get more people who receive medical insurance from us to go get annual preventative care visits.
Yes. Carter, I see that you have your hand up. Can we wait till the end for your question?
Okay, I just wondered what the difference was between the 2 different blues. What do they represent?
The years. So April from year 22 to 23 is a light blue, and the dark blue is 23 to 24.
Okay, thank you.
Of course. We're going to jump over to pharmacy costs. Our total healthcare claims paid was about $1.8 million, with the majority attributing to medical claims. The prescription drug costs billed through medical benefits, which is the medical RX, were at a minimal $6,000. But most of those prescription related spending, which is at 98.6 that you see, was processed through the pharmacy benefit. Only 1.4% of that was billed under the medical benefit.
Wow.
And then we're going to continue on prescription care, but this time we're going to look at a slide that breaks out per member per month cost. That's that PMPM abbreviation that you see there. Our overall pharmacy spending increased 7.6%. There are lots of information here, but we're going to look at just a few of the pieces that were overall important for us. Is our non-specialty drug costs rose 28.3%. That is a huge change, and it's still up way above benchmark. So you can see that the benchmark over there in the gray, it was $77, and we're averaging $108. Our retail pharmacy spending increased 55%, and our mail order utilization did decline 24%, but this is meaning that we're probably seeking higher cost dispensing locations and services. Brand drug costs continue to trend upward 9.8%. And CPG has said before in other webinars that we don't see that cost declining for anybody across the greater Episcopal Church. Despite improved discounts and lowering specialties, total pharmacy per month per member costs are going to be continuing this trend too high. Pharmacy utilization. Our average pharmacy cost per member increases each year. We're going to continue to see that as the market overall increases and things become more expensive. Our members filled slightly fewer prescriptions per member, but our utilization continues to remain high. Our generic dispensing rate increased slightly, and our mail order usage remained flat. Formulary brand compliance declined slightly, but our maintenance medication refills increased. So per days per year did decrease, but we still have really high pharmacy utilization rates. Okay, and now we're going to look at the cost analysis for the projections and what it's looked like year to year to pay for healthcare premiums. In 2023, I gave you the flat rates. It started at $681, and now for our single PPO, we're paying $762 for the same cost over 4 years. So plans overall have increased about 4.5%, and we're planning to see another 4.5 increase to cost plan premiums going into 2027. Our data shows that the HSA plans do increase, but at smaller rates and have been more stable across time than the PPO plans. So we do have a plan that we are asking some of you to take back and install or to talk about to promote long-term financial sustainability. There are things that we can do to try to lower the premiums because the overall Episcopal Church subsidizes.
Uh-oh. What happened?
Are you there, Clarissa? All right. Well, the good news is I also have the presentation, though I do not have as much knowledge as Clarissa does in particularly the benefits. But let me present our view and then share my screen. Let's see. Nope, that's not the one I want to do.
Oh, nice.
So I'm not sharing the one with the notes. I want to share the one without the notes. Let's see my screen. There we go. All right, and I am gonna. So here we go. So she was saying this is our plan to make things better, and as soon as she gets back on, she will share more of this. But essentially, if you are 65 or older and you are eligible for Medicare, and you are also being covered by your Episcopal Church Medical Trust coverage, we would encourage you to switch to a Medicare secondary payer plan, which makes Medicare your primary payer and means the costs for the insurance that we provide for you cheaper. So if your priest is 65 or older and eligible to that, we encourage you to explore if that is an option for them and for any other members of their household who are covered. We can't require this, but we can at least offer it. Clarissa, you're back?
Yeah.
Okay.
Sorry about that, everyone.
It's all right. I'm sharing the screen now. I just did item 1.
Awesome. So we can move on to section 2, promoting preventative care, which we did talk about a little bit prior. When we encourage our employees to consistently complete their annual medical and dental preventative visits, we observe lower emergency and high equity claims. The reduction of this reduction in avoidable utilization directly influences renewal calculators, often resulting in lower annual premiums. Preventative care is not merely beneficial for individual well-being, but it's also a strategic cost containment. We're going to go down to number 3. Incentivizing enrollment in the HSA compatible plans. For some of our larger churches or churches that can afford to give contributions to an HSA plan, they can substantially lower their premiums. And that could save them up to $1,000 per employee annually. This can be beneficial for some churches, but some cannot afford to make those contributions. So just take that as you can. And then even though CPG doesn't have specific tobacco-free promotions going on right now, when we support employees who are willing to go tobacco-free, they reduce the likelihood of chronic conditions, and that also drives long-term medical care costs. So asking people to be tobacco-free can help in reducing costs over time. And then we also want to encourage participation in wellness and activity programs. CPG offers a program called FabFit, which employees can find in their Quantum application. They also offer coaching and health wellness initiatives. This will improve our costs overall in the long run, and it will generate fewer high-cost claims. So encouraging our employees to also be active will help. And we're going to open it up for questions.
And if you could use the raise hand feature, ideally, to ask questions, that would help us. Are there any more questions? Yes, universal appeal.
First of all, I am can you hear me?
Yeah.
Yes.
Sorry, I'm David Hale from St. Matthews in Chandler. I could not change my name for my podcast, so it's David Hale. I had 2 questions. One, as far as, has it ever been considered to pair with other churches to bring down the cost? I know that there are Christian-based healthcare services where they kind of combine buying power. And then my other question was, do we consider transitioning deacons to the priesthood and working that out where we can get young deacons to then transition to priesthood, or do we just go ask people to do the calling to just become priests?
Good questions, both of them, and I have answers particularly to the first one. So in 2008 or so is when the Episcopal Church decided that, I think it was pre-Obamacare, realized that we had a real problem providing health insurance and health benefits to employees of Episcopal churches. And so the General Convention passed the creation of the Episcopal Church Medical Trust, which is a self-insured plan that works, and it made it mandatory for every diocese and every Episcopal entity to participate in it. It's run through Church Pension Group, and I think it's possible that with the advent of Obamacare, they might have made different choices, because at the time it was impossible to get health insurance kind of wherever you were. Though at this point, given what's happening to the ACA, it's probably good to have this here. But so we are not allowed to look for alternate. In the Diocese of Arizona, we're not allowed to look for alternates. The Episcopal Church Medical Trust, the General Convention did a big investigation between 2022 and 2024, and changed some of the policies that they were required to work under. Essentially, if you were in a high cost medical like if you were in New York, let's say, or someplace really rural where medical care is very expensive, essentially anyone who was not in that place was subsidizing the expensive places. And in some cases, poorer dioceses were subsidizing higher dioceses. So they did some great work on that and are able to make some changes. And so I think the fact that we didn't have a big bump last year was partly as a result of that. and also gave us the data of trying to encourage people to get off of things like the platinum plan, because the people on the silver plan end up subsidizing the platinum plan. And so, you know, we offer the silver plan as the baseline for the diocese. That's what I'm on. That's what my family's on. And, you know, people can choose to opt into the platinum plan, but it hurts kind of everybody when they do that. So we aren't allowed to do the bonding together with other people, except at the church-wide level. If you feel passionate about that, you should talk to your general convention representatives, because it's the general convention that has the capacity to change that. In terms of calling people into the diaconate and then ordaining people who are currently deacons as priests, the call of the deacon is different. You know, deacons are called, it's not just like, you seem holy, you should be ordained. And in fact, in our diocese, we ordain a lot more senior citizen deacons than we do young deacons. So there's not a big flood of young deacons coming in that we could then pull into the priesthood. But I think from our perspective, we're also looking at calling a broader range of deacons. Like, you know, we've had a couple deacons in the last few years who've been ordained who were, you know, under 50, which means young in the Episcopal Church. And that's been good, but, you know, trying to sort of push that forward. And we do occasionally ordain a deacon as a priest, you know, so every so often there's a deacon who feels a different calling coming, and our comm works with that. So, Linda.
Okay. The diocese has a mandatory retirement age of 72. Is that correct?
For clergy, yes. And it's
What
not
about
the diocese, it's the Episcopal Church.
Okay. What about deacons?
Deacons, so all clergy have a mandatory retirement age of 72, but mandatory retirement does not mean that you are not allowed to serve anymore. Mandatory retirement means you need to retire, and then one of two things happens. For priests, generally, it is retiring from the congregation in which you serve. And then it is our retired priests who are able to help us out with interims and all sorts of wisdom. You know, our retired clergy who want to be active are active. For deacons, it often means 1-year reappointments to where they're serving, depending on what they're wanting to do. Deacons do often retire in place, but priests generally do not.
Wouldn't it be reasonable if the retirement age were extended? I mean, there's some very vital 72-year-old priests, I mean, who could stay in the congregation for another 5 or 6 years, and that would help to eliminate some of the congregations that don't have priests.
Yes and no. So our mandatory retirement age for clergy in the Episcopal Church is, I think, the highest in the Anglican Communion. In England, it's 70. In Kenya, it's 65. I just know Kenya because I was just there. So yes, there are very vital priests who are 72. There are also, let's be clear, and I'm not talking about any one church in specific here. Hear me, okay? There are some rectors who retire in place. They get a good job. They're happy doing what they're doing. And they just ride it out for as long as they want. And they're not really active. And because of our system, there is no easy way to move a rector on to do that except retirement. There was a group that brought this to General Convention at 2024 for studying. I don't think the House of Bishops would pass it. I am able to, on occasion, and I've done this several times, where I've extended a priest who's a rector for another year or so. You know, I do that occasionally, but I don't want to sort of like, I don't think that's the solution to the problem. Good question, though. Marty.
Yes. I'm just wondering if this printout or this presentation will be available for us to print out if we might want to share it with our rector, say, in September.
Absolutely.
Awesome. Thanks.
Carter.
Thank you. I had a couple of questions on the health insurance, and then I think we'd all like to know what color we are on the risk assessment.
I mean, some of you do want to know, and some of you don't.
Who is our current medical insurance provider?
So we all work with CPG. We use Quantum as like our third-party claims department, helping you navigate that. But then the two main providers that we offer currently are Blue Cross Blue Shield and Cigna.
Okay.
And those are optional, so you can decide, the employee can decide which one they use.
Okay. My second question then goes to the Medicare. I currently am on Medicare A and B,
Okay.
and I have a full Blue Cross Blue Shield policy through the federal government. And every year, because I'm a Medicare B take Medicare B, Blue Cross Blue Shield rebates me some $1,200 a year. And I wonder if we've ever approached our providers to see if they would do that same thing for Medicare recipients.
So Carter, I think you're talking about two different things. So the for Medicare, when it's a Medicare secondary payer program, which we do offer, but we've not really pushed, those are for people active in ministry. Once you retire as a priest in the Episcopal Church, because it's usually priests who retire with years of credited service, like deacons can do that, but it doesn't happen very often. The CPG does provide Medicare Part B for retired clergy, and provide retirement health benefits above Medicare for people, which I think is probably what you're on. So they do that, but this presentation is not about that. And we work with our retired clergy representatives, Colville and Sylvia Smith, work with CPG to help explain that to our retired clergy and stuff. So they do exactly, I think, what you're describing with the retired clergy.
Okay, I'm not sure. My Medicare is primary. Blue Cross is secondary. But because I pay the full amount of my Blue Cross, they rebate me that $1,200 every year, because they don't pay as much for me as they do for someone that's not on Medicare.
Yeah, and the MSP plan that we're talking about for active participants is going to be better for the institution's premiums annually. And you can be active in Medicare, but it technically kind of drops Part A, and you would then use your Blue Cross Blue Shield or Cigna as your primary, and your Medicare would be your secondary. In this case, Carter, that doesn't apply in the same way for you.
All right, so who wants to know what risk assessment level they're at? All right, I got to get to that slide.
I'm on it.
You're on it? Okay. Okay, so, well, Carter, you raised your hand, right? So St. Peter's Litchfield Park is... Okay, it's going to be really hard to... All right, St. Peter's, congratulations, you're green.
Thank you.
Yay! As I do this, I realize how hard it is to actually look these things up as in real time. So I'm just going to run through some congregations that I see are present in the room, because I can see you here. So let's see. So red congregations that I see here are St. James Tempe, St. Mark's Mesa, orange would be St. Francis in the Valley is orange, St. Philip's Tucson is orange, CCA Scottsdale is orange, Christ Church of the Ascension. Yellow, I see people here from, I think, St. Albans, Tucson, and Grace St. Paul's, Tucson, and St. Stephen's, Phoenix, All Saints, Sun City, St. Christopher's, Sun City, and Advent. Basically, if you're in Sun City, you're yellow right now. And green is, let's just celebrate the green congregations. St. Luke's Prescott, Our Savior Lakeside, St. John's Globe, St. John's Williams, St. Albans Wickenburg, St. Philip and St. James Morenci, which no longer exists, but they were green before they stopped. All Saints Safford, St. John's Bisbee, St. Stephen's Sierra Vista, St. Matthew's Tucson, St. Michael and All Angels Tucson, St. Andrew's Tucson, Christ the King Tucson, Apostles Oro Valley, St. Matthew's Chandler, Epiphany Tempe, St. Luke's at the Mountain, St. Barnabas Scottsdale, St. Anthony Scottsdale, St. John's Glendale, and St. Peter's Litchfield Park. Barb is asking for Benson. Where's Benson? I would think you'd be green. All right, well, we're gonna have to look for you guys, Barb. You can put the color slide back up. Let's see. Yes. Oops. There we go. And then, oops. There you go. And again, this is based on parochial report data and things like that. So there is chances that there were some of these that when I saw them, I was like, I know that church. That's not true. There's some green churches that are not green. And there's some red churches that are not red. But all right. Any other questions?
Scott?
Yeah, Scott.
Hi, I didn't hear nativity on that red, green, orange, blue, whatever it is.
Yeah. Looking for you.
Okay.
All right, we'll get back to you.
Okay.
Too,
But I also have another question on the it was like not a chart, but the ones with a circle. What is that called? I forget. A table or something. On the prescription drugs where it had let's see here. Maybe one back. That one. Yeah. So I don't quite understand that. Can you dumb it down for me? What does that arrow mean for the red medical? Is that good or bad?
So when you receive pharmaceuticals, the way that the doctor like codes it is between either that red medical or medical RX. Medical RX means that you're probably in emergency room or receiving you're receiving outpatient surgicals, and those are the medications that the doctors are giving you during your surgeries, is that green sliver. All the medical red can be considered like CPAP machines. Women's breast pumps are considered pharmacy costs. Those are all those like medical, like larger medical expenses. The pharmaceuticals, the pharmacy one is the ones that you get from the pharmacy, your pills, your insulin. So they are categorized different, but unfortunately they didn't give me like a written out category of each one. I kind of had to do some research on that. But the green sliver is the medication that you would receive during surgery.
Okay, thank you.
Any other questions?
Yes, Good Hills of the Shepherd. I mean,
Good Shepherd of the Hills.
Good Shepherd of the Hills.
But the hills are good too.
Good Shepherd.
All right. So if you would like a copy of this presentation, I would ask that you email Clarissa at clarissa@azdiocese.org. Since we didn't have you register, we don't necessarily know who's here. There's her email. So Clarissa, congratulations. You're about to get 20 emails.
Lovely. I look forward to hearing from every one of you.
Yeah. But thank you for coming today, and we find this information interesting and helpful, and we hope you found it interesting and helpful, and we're happy to, Clarissa particularly is happy to work with you on on more of this, because we want ourselves to be good consumers of our particular medical insurance, because it's such a big chunk of every church's budget that has somebody with medical insurance on it. And anything we can do to help keep those costs lower, we should be doing. So we're grateful for all of you. All right. Thank you.
Thank you.
Thank you.
Thank
Blessed
you.
Ascension Tide.
Thank
Oh, hey,
you.
Susie.